Hello and welcome to Base Hospital's podcast. Today we are exploring a topic that affects many people worldwide, that is head injury. Head injuries don't just happen to athletes or accident survivors only, they can affect anyone, anywhere, or anytime. Joining us today, Dr. Sandeep Varma, consultant brain and spine surgeon, having wide expertise in treating and managing head injury. In today's episode, he will delve into the causes, risk factors, complications, treatment options, and preventive tips for head injuries. Dr. Sandeep Varma, thank you for joining us at Pace Hospital's High Tech City. Shall we first understand what exactly is neurotrauma?
Neurotrauma refers to any injury occurring to brain and spinal cord caused by sudden assault or a force acting on the body.
So, doctor, could you share some insights on the common causes of head injuries?
Head injury can occur due to various causes like fall, road traffic accident, assault, sports injury, etc.
Dr. Sandeep Varma, when it comes to head injuries, what are the key symptoms that someone should watch out for after a head injury?
Symptoms of head injury can occur from varying intensity. It can be as simple as a headache to vomiting, dizziness, loss of consciousness, epilepsy, neurological deficits like weakness, coma.
Could you explain the common risk factors of head injury?
Risk factors for head injuries are drivers, motorcycle drivers who don't wear helmets, construction workers without safety equipment, children during playtime or any sports injuries, old age people who have tendency to fall at home or while work or mostly in washroom, etc. These are the most common risk factors for traumatic brain injury.
So, doctor, could you explain some of the common and severe complications that can result from head trauma?
Complications of head injury can be post-concussion syndrome or more severe complications like intracranial hemorrhage, epilepsy, respiratory deficit, need for ventilator support, weakness of limbs, bowel and bladder incompetence.
Dr. Sandeep Varma, one important question that comes to mind is about the diagnostic test. So, what diagnostic tests are typically used to assess head injuries?
Diagnostic tests for head injury are most commonly used the CT brain, MRI brain and MRI spine. We can also diagnose head injuries if CT and MRI are not available using X-rays also, through which we can identify any skull fractures or any vertebral fractures.
So, doctor, what are the key treatment approaches for head injury?
Treatment for head injury depends on the severity. Simple head injuries can be treated by observation, medication, and rehabilitation. Complicated head injuries may need surgery, prolonged ICU care, ventilator support, prolonged physiotherapy, and neurorehabilitation.
How can we prevent head injury?
Head injuries can be prevented by simple precautions like wearing seat belts while traveling in a car, wearing helmets while traveling on bike, safety precautions at workplace like helmets and handrail, educating children about sports related injuries and how to play sports safely, and taking care of old age people. These are various ways how to prevent head injuries.
Dr. Sandeep Varma, is vomiting after head injury dangerous?
Vomiting after head injury, especially continuous multiple vomitings even without having any food, and vomiting, projectile vomiting, are dangerous signs after head injury. They indicate increased in intracranial pressure and may immediately need intervention from a neurosurgeon.
Can a head injury cause vision problems?
Head injuries may lead to visual problems like blurring of vision, diplopia, photophobia, etc. These occur due to damage to optic nerve or other optic pathways in the brain.
So, doctor, can head injury cause a brain tumor?
Usually, head injuries are not known to cause brain tumors.
Dr. Sandeep Varma, how long does it typically take for a head injury to heal?
Healing time of head injury varies with the intensity of the head injury. A simple concussion or post-concussion can heal within 2 to 3 weeks, and severe head injuries like diffuse axonal injury or intracranial hematoma or contusions may take months or sometimes years to heal completely. Or some critical head injuries will not heal at all. Maximum we can get is functional ability of the patient.
So, doctor, many people experience frequent headaches after a head injury. So, is a head injury often the cause of these recurring headaches?
Yes, headaches can occur after traumatic brain injury or head injury. This can be due to as simple as concussion to as major as skull fracture, intracranial hematoma, etc. Take home message from our today's video is head injury, even trivial or small, can lead to permanent lifelong damage. It is better to get evaluated as early as possible by a trained doctor or a neurosurgeon who is available near your facility.
Thank you, Dr. Sandeep Varma, for sharing crucial information regarding head injury with our listeners. Hello, listeners. If you have any further questions regarding head injury, please don't hesitate to consult a brain and spine surgeon. Remember, early intervention is crucial. Catching head injuries early can make all the difference in preventing long term damage and ensuring a smoother recovery. We will see you soon on the Pace Hospitals podcast with another episode. Until next time, take care and stay healthy. Thank you.